I get a lot of the same fertility questions from patients and people who are just starting their pregnancy journeys. This video is just about that. Real questions, real answers, and a lot of clarification around things that are often misunderstood. Hi, my name's Ina, a naturopathic doctor focused on fertility and a proud mama of 4 after 30. Let's dig in. Question number 1. What is a naturopathic doctor who specializes in fertility? I don't specialize in fertility because there's no such concept in naturopathic medicine. There's no actual specialization program that you can do to say that you specialize in one field over the other. What I do say is that I focus on fertility because my patients are by far all either trying to get pregnant, are having issues with losses, or are thinking about getting pregnant in the future. So what I mean by saying that I focus on fertility is that I'm seeing these kinds of patients all day, every day. Also, because this is the field that I have so much interest in, I do most of my continuing education courses in fertility so that I can stay up to date on the latest research and developments in the field. And lastly, because fertility is so pattern-based, once you realize those patterns and you see them over and over again in your patients, you become a lot better at recognizing what might be holding a couple back from getting pregnant. Next question. If all my labs are normal, why am I still not getting pregnant? Good question. This happens because labs only tell us that you're not sick and there's not something that's catastrophically wrong with you. They don't tell us anything about how well your body is doing at the job of getting pregnant. In order for you to conceive, several things have to be aligned and happen in sequence. So for instance, you have to ovulate. Then you have to make sure that your hormones rise and stay elevated for the duration that's necessary, and that your lining is ready and welcoming when that embryo finally comes to implant. Missing any one of those steps will prevent you from being pregnant. So even having absolutely normal labs, when pregnancy doesn't happen, it doesn't mean that your body is not trying. It just means that somewhere there's a break in that sequence of events that has to happen. And lastly, most fertility problems are functional, not pathological, which means that your values can still be absolutely within the normal range, but they might be insufficient to support implantation or early pregnancy. And that's why pregnancy can happen without changing lab numbers, because the function gets better even if the number doesn't, and that improves fertility. Question number 3. How long should it actually take to get pregnant? And when should I get help? This question we're going to have to tackle by age group because it really does depend on age. You probably heard that most couples have a 20 to 25% chance of getting pregnant every cycle, but this only applies to younger couples. So let's break it down. The 20 to 25% chance per cycle applies to couples usually under 35. And for those, 80 to 85% of them will be able to get pregnant by themselves within the first year of trying. That said, if nothing happens within 6 months of properly timed trying, it's definitely reasonable to seek help and dig a little bit deeper to see what's actually going on, even if everything looks normal. If you are between 35 and 39, the chances per cycle drop to about 10 to 20% depending on where you are in that age range. And because of that, I would definitely not wait a full year. If nothing happens in 3 to 6 months of well-timed trying, it's definitely a good idea to get some advice and to dig deeper. If you're 40 and over, your chances per cycle are about 5 to 10%. And at this point, waiting for the full year is generally not helpful. The bottom line is, age doesn't necessarily mean panic. It just tells you how long is reasonable to wait before getting help. Question number 4. Is stress really affecting my fertility, or is that just something doctors say? Stress generally does not stop ovulation, but there are certain types of stress that actually can. For example, severe crash dieting, over-exercising and not getting enough calories, weeks of poor sleep, or major life stressor like significant illness, maybe grief, and postpartum strain. In those situations, the brain can decide that this is definitely not a good time to reproduce and ovulation will become weak, delayed, or missed. But general stress that we feel on a day-to-day basis can definitely affect things like your progesterone levels, implantation, and early pregnancy stability. For example, having high cortisol can directly impact how receptive your uterus is, even if your cycles look absolutely normal. So no, it's not just relax. But stress on the body is real and it definitely can affect fertility. Next, am I definitely ovulating just because I get a period every month? No. You can absolutely bleed regularly, but ovulate weakly, ovulate inconsistently, or not produce enough progesterone afterwards. A period only tells us really that estrogen rose and then dropped. It doesn't tell us if ovulation actually happened or if progesterone rose enough and the luteal phase was long enough to support implantation. That's why tracking more than just your cycle matters. So things like cervical mucus, basal body temperature, and LH strips. Number 6. What are the biggest fertility mistakes people make without realizing it? That's a good one. There are a few, but the biggest 3 that I see are: number 1, assuming that if you have regular cycles, that you have optimal fertility. Number 2 is relying on apps instead of actually studying your body and using your physiology to predict things like timing, mostly because apps would estimate ovulation based on your averages instead of actually using things like your cervical mucus or your LH surges to determine what is actually happening in this particular month in your body. And number 3 is really waiting too long to have both partners tested, because waiting doesn't actually change what's going on. It just delays you getting the information you need. Number 7, can I improve egg or sperm quality naturally, or does age make it pointless? Yes, you can definitely improve egg and sperm quality at any age. Age usually affects quantity way before it affects quality, especially if you support the cells properly. The thing is that both eggs and sperm reflect what's been happening in the body for months beforehand. So for example, when you talk about the eggs, they take about 3 or more months to really have any changes because the eggs take a really long time to mature. For sperm, things are a little bit easier because the sperm cycle is about 70 to 90 days, and you will usually see changes after one spermatogenesis cycle. So you would say, hey, Ina, it's 3 months for the girls and 90 days for the boys. Yes, it's not necessarily the timeline. It is more about how predictable the changes that we see in sperm and egg quality is. So sperm tend to respond faster and more predictably, while egg quality is usually more gradual. So age really just changes your strategy. It doesn't cancel it. Number 8, how much does diet really matter for fertility? Well, it's more than people expect, but less than people actually fear. What most people don't realize is that a small change, only 5 to 10% in your metabolic health, will give you about 80% of the benefit in terms of your fertility. This is not about perfection. It's about decreasing inflammation and supporting your hormone signaling, because blood sugar instability and chronic inflammation disrupt ovulation, progesterone production, and sperm development. And diet is one of the fastest ways to influence those systems without medication. Next question. Question number 9. What are the best foods for fertility? There's a few foods that I always come back to when I think about fertility. Leafy greens, like spinach and kale. These are great for blood sugar stability, calcium, iron, and folate. Berries are great for their antioxidant properties, anti-inflammatory properties, vitamin C, zinc, and folate. Nuts, especially walnuts, for protein, fiber, magnesium, and vitamin E, which all support the uterine lining. Salmon, which is a low mercury fish that is high in omega-3s and DHA. I usually suggest 1 to 2 servings a week and try to get wild caught when possible. As a general rule, I do suggest choosing organic products when possible to my patients because that reduces the pesticide exposure and toxin load, which can interfere with fertility. So there's really not one magic food that I would recommend for fertility. Fertility responds better to patterns instead of superfoods. As a more general guideline, if I would have to narrow it down further, I would focus on foods that do the following things: support hormones, reduce inflammation, and stabilize blood sugars. That would usually look like this. Number 1, quality protein at every meal. Think eggs, legumes, fish, poultry. Number 2 would be healthy fats, so think olive oil, avocado, and nuts and seeds. Number 3 would be lots of vegetables, think leafy greens and cruciferous vegetables. And number 4 would be whole food carbs that don't spike your blood sugar. So this is less about adding fertility foods and more about removing things that would disrupt your hormones, such as ultra-processed foods, constant snacking, and big blood sugar swings. You don't need a perfect diet. You just need a consistent one that your hormones can rely on. Next question. Question number 10. Why does unexplained infertility happen, and is it actually unexplained? Most of the time, unexplained infertility isn't truly unexplained. It's just unmeasured. Unexplained just means that basic testing did not reveal a diagnosis. Ovulation appears to be happening, tubes are open, sperm count is acceptable, but the pregnancy is still not happening. The problem is that fertility depends on function, not just structure. Things that are commonly missed include things such as ovulation that did happen but isn't strong enough or well-timed, progesterone that rises but isn't high enough or long enough, sperm that look fine on a basic analysis but still have poor DNA integrity, inflammation that interferes with implantation, and an embryo that forms but fails to implant properly. None of these would show up as a single abnormal lab value. In clinic, unexplained infertility becomes understandable when you zoom out and look at things like ovulation, not just that it happened, but how it happened. Hormone timing across the entire cycle, not just one snapshot. Sperm quality beyond just count and motility, and metabolic and inflammatory factors that affect fertility. That's also why many people with unexplained infertility eventually conceive. Not because the issue resolved on its own, but because conditions were slowly improved and the right cycle eventually lined up. So, unexplained does not mean hopeless. It just means that the right questions were not asked yet. Next question. This is going to be crazy. Do supplements and herbs actually work for fertility?